Hello, Cancer Guy here. I want to talk about a brand new treatment for first-line HER2 positive breast cancers. And this involves one of the greatest new advances in cancer treatment called antibody drug conjugates. But first off, our disclaimer. Please make sure you have read and understood the disclaimer before moving forward with this video. So, as most of you know, first-line standard care for HER2 metastatic breast cancer typically includes a triplet regime of pertuzumab, trastuzumab or Herceptin, and a taxane chemotherapy drug, followed by pertuzumab and trastuzumab maintenance as long as there's a response. Additionally, antibody drug conjugates like TDM1 and TDXD are often used for recurrence or residual disease after initial therapy has failed. However, a recent study, and this is not unexpected, shows that using TDXD or Enhertu in the first line for metastatic HER2 breast cancer results in significant improvements. In other words, starting on the right targeted drug for your molecular alterations results in long-term remissions. However, standard care typically involves, sadly, saving the best for last. So before we go any further, I'll just talk about ADCs. But the point of this video is you want to use the best drugs early on, upfront, and not save them for last. So ADCs are antibodies with a drug conjugated to it. So TDXD basically targets unique receptors such as HER2 or cell antigens. Other ADCs target cell antigens and other receptors and so on that are overexpressed in cancers. They contain an antibody, which in this case is trastuzumab, that is attached to a powerful drug, DXD, via a conjugate molecule. The conjugate molecule ensures the drug stays attached in an inactive form to the ADC while it is in the body looking for the tumors, with the HER2 receptors, of course. The result is less side effects because the drug is not released by the conjugate until it is attached and internalized by the tumor cell. So when the ADC binds to the HER2 receptor on the tumor cell takes up the ADC and the conjugate is dissolved, releasing the drugs internally. So this is very similar to the Greek mythology, the Trojan horse. So killing a tumor like a Trojan horse is how I like to view it. Many ADCs, like TDXD, have something called bystander effect, where there is enough of the drug to not only kill that tumor cell, but also kill the neighboring cells that may not actually have HER2 receptors. So this is 2 for 1, basically. The bystander effects allow TDXD to work in HER2 low environments, and that's because HER2 low means that not every tumor cell is going to have a HER2 receptor, or even around cells that don't have a HER2 receptor at all. As you can see in the top, the drug here, TDXD, with its classic monoclonal antibody shape, Y shape, attaches to the HER2 receptor on the tumor cell here, internalizes it. It gets broken down by the lysosomes and the other things inside of the tumor cells, releases the chemo drug, and it kills the cell from the inside out. Then some of the chemo drug also leaks out from the dead tumor cell and kills the bystander cells. In other words, as you can see, this cell doesn't have a HER2 receptor, and therefore it wouldn't normally be affected by TDXD, but because it's next to a HER2 positive cell, it's getting killed as well. And that's the bystander effect. So the Destiny-9 trial involved patients with HER2 positive advanced or metastatic breast cancer who had no previous chemotherapy or HER2 directed therapy for metastatic disease. Patients were randomized to either get TDXD plus pertuzumab or TDXD plus a placebo or the standard care, a taxane plus trastuzumab and pertuzumab. Interestingly enough, the trial showed that the TDXD plus pertuzumab was superior to the other combinations. And this makes sense. It makes sense because trastuzumab binds to the subdomain 4 on the outside of the HER2 receptor. So these are external components of the HER2 receptor. So Herceptin or trastuzumab binds to the domain 4 of the HER2 receptor, while pertuzumab binds to the subdomain 2 of the HER2 receptor. So they have different mechanisms. And this is important because the subdomain 2 is very close to the surface of the cell, and the subdomain 4 is a little further out. So sometimes the external portion of the receptor can break off, or it can be mutated or altered, and then trastuzumab wouldn't bind it because the subdomain wouldn't be there. And that's why pertuzumab can help in this situation. So having two drugs that target the same receptor with very different mechanisms can really open up how the treatment works, and they can really change and create a synergy that you can't get from a single drug. So for example, trastuzumab binding to the domain 4 inhibits HER2-mediated signaling, and this promotes receptor internalization, meaning the receptor gets taken inside of the cell, and also induces something called antibody-dependent cellular toxicity, ADCC. And then binding of pertuzumab to domain 2 inhibits what we call dimerization. And dimerization is another mechanism that activates the HER2, apart from ligand-dependent or independent processes that Herceptin or trastuzumab inhibits. Dimerization is where two of the HER2 receptors bind together. Now, there's 4 different HER receptors. There's HER1, which is also known as EGFR. There's HER2, there's HER3, and HER4. And so pertuzumab actually inhibits these 2 receptors binding together and turning each other on through a process called dimerization. So a completely different mechanism from trastuzumab. The important thing is by blocking dimerization, it reduces intracellular signaling pathways such as PIK3CA, AKT, and also stimulates the antibody-dependent cellular cytotoxicity. So a multitude of mechanisms above and beyond. And this is something that's really important to understand, because PIK3CA and AKT mutations can really make a lot of breast cancers treatment resistant. So in other words, using T-DXd combinations with pertuzumab will affect more cancer-causing signaling pathways, as the mechanisms of the 2 antibodies are different but very complementary and synergistic. And once again, this is really important in the context of secondary alterations such as PIK3CA AKT signaling. And that's because these create resistance to standard therapies or Herceptin for that matter. So this is a nice little slide I took off the internet. I love what these people are doing here. They're doing a nice little summary job. As you can see, the combination was vastly superior. So it resulted in a 40.7 month progression-free survival compared to only 26.9 months for the standard care. That's a 44% reduction in risk of progression. Complete response rate, which is really important, was 50.1% versus only 8.5%. But here's what I really want to show you. In the PIK3CA mutated cohort, they had a really good response rate. So as you can see, if you have a PIK3CA mutation, you have an aggressive disease that is largely treatment resistant to standard care. So standard THP only resulted in an 18.1 month, where the T-DXd plus pertuzumab, it was 36 months. So definitely a substantial difference. Also, HR negative, and that's another subcategory of patients. They had 22.6 months versus 40.7 months for the T-DXd pertuzumab. And so definitely a great option to use in the first line. It is FDA approval as far as December 25th, and EMZO has validated it in early January 2026. So while this study focuses on patients with HER2 having a 3+ score on IHC, other studies have proven that this drug is also very effective in patients who would not be considered HER2 positive, such as those with scores of 2+ or 1+ or even 0. I've seen phenomenal results in patients that had a 1+ or 2+ score. So that's where these ADCs are going. The better they get, the better they're going to be able to work with lower HER2 IHC scores. So a little bit about what we do. We have a wonderful consultation service. Additionally, Michelle has a wonderful precision cancer medicine education and advocacy program. I highly recommend this. Also, since you're watching this on your YouTube channel, highly recommend pressing the subscribe button so you'll get informed when new videos come out. Okay, have a great day.